Hello, everyone. Thank you for joining us for today's webinar. It's entitled Medicaid, Who It Helps and Who Still Needs It. I'm Kanika Young. I'm the Senior Director of Health Policy and Advocacy at the Tennessee Justice Center. Just a couple of logistics before we get started. If you have any questions during the presentation, please type them into the Q&A box and there will be time at the end to answer questions. Also, a copy of the slides will be emailed to everyone, as well as a recording of the webinar. So if you know people who couldn't make it, feel free to share that with them. So just a little bit about the Tennessee Justice Center for people who have not heard of us. We have been around since 1996, helping Tennesseans access healthcare and nutrition. We represent individual clients across the state who have issues either enrolling or getting services that they need from our Medicaid program, as well as our nutrition assistance programs like SNAP and WIC. We also do trainings for providers to help them navigate these public benefit systems for the clients that they serve. And we advocate for systemic changes based on the information that we receive from representing individuals and working with other providers who spot issues that have systemic impact. And so we advocate through litigation. We are a law firm. We also do lobbying as well as grassroots organizing. So today we will be talking about Medicaid. So some of you may be familiar, and for others, this will just be a refresher. But Medicaid is our nation's public health insurance program for people with low incomes. I emphasize health insurance because there's some confusion about what Medicaid is and what it isn't. Some people like to malign the program by referring to it as welfare. Medicaid is different from what most people would consider a typical welfare program in that it is health insurance. It does not provide cash to people. It simply gives them access to health care that they need if they qualify. Medicaid is the largest source of insurance coverage in the United States. It covers more than 70 million Americans, or 1 in 5 people, including many people with complex and costly healthcare needs. And in Tennessee, Medicaid is known as TennCare. So a few basics about the Medicaid program. It was first enacted in 1965 as companion legislation to Medicare. Um, Medicare is often confused with Medicaid. They are two different programs. They have different criteria for who qualifies. Basically, Medicare is for people who are over 65 and some people who have disabilities that qualify for coverage under the federal program. Medicare is also different from Medicaid in that it is administered solely by the federal government. The state does not play a role in administering the Medicare program. Medicaid, on the other hand, is a federal state partnership. The federal Medicaid funds that Tennessee has in its state budget accounts for 1/5 of our total state budget. So the federal funds are complementary to the state funds that Tennessee puts in to operate our program. Originally, the Medicaid program was focused on the so-called welfare population those were single parents with dependent children and people who are aged, blind, or disabled. It guarantees entitlement to eligible individuals and federal financing to states. Entitlement simply means that it's not capped. Anyone who qualifies, who meets the criteria for the program, are entitled to enroll. That's what entitlement conveys. And it also includes mandatory services and gives states options to cover more coverage if they choose to. So each state can design their program in different ways to meet the needs of their residents. So here's just a little overview of how the federal state partnership works for Medicaid. In terms of administration, the federal government provides oversight, but the state is responsible for directly administering the program. That means signing people up, creating provider networks, and processing claims for people. In Tennessee, we are a little bit different in that we have a completely managed care model for our Medicaid program, meaning that the state contracts with managed care organizations, more commonly known as insurance companies, to do that administration. So the managed care organizations, or MCOs, are responsible for setting up the provider networks and processing claims for people who are enrolled in their plan. In terms of financing, the federal government pays on average 50 to 73% of the cost with no cap. And then the state pays the rest of the cost for the program. In Tennessee, our matching rate is on the higher end at around 65%, but there's a bump right now in place because of the national public health crisis that we're facing. So the federal government is paying a higher percentage of the cost of our Medicaid program to account for the fact that more people are enrolling in the program right now because of the economic downturn, and also because of healthcare needs that may be higher due to the coronavirus. And so the state is receiving additional federal financing to run the program right now through the end of the public health emergency, which I believe has been extended recently to the end of the year. In terms of program rules, there are minimum standards, strong benefit and cost sharing standards for children specifically, called EPSDT, and we'll talk about that a little bit more later. That's set by the federal government, those minimum standards. And then the state sets things like provider payment rates and decides whether to cover beyond the minimum, so to cover more things than what the federal government requires to be covered. And then in terms of a coverage guarantee, as I mentioned, it's an entitlement program. So they are required to cover people who are eligible. And on the state side, they cannot freeze or cap enrollment unless they get permission from the federal government. And they also do have the leeway to erect enrollment barriers if they choose to, but they would also need to not run afoul of some basics that the federal government has established. So who is eligible for Medicaid? Um, if people can hear me, if you could just type something in the chat or in the Q&A box. I just saw a message from someone that said they can't hear anything. So I just want to make sure people can hear me okay. Okay, great. Thanks. Thanks for letting me know. Okay, so who is eligible for Medicaid? There are a few primary categories of people who qualify. You have infants and children, you have pregnant women and parents or caretakers of children, people with disabilities, and older adults. Those are the primary categories of people who qualify for Medicaid across the country. In addition to having to fit within one of those categories, you also have to be under certain income limit, and the actual amount varies depending on the category that you're in, and also it depends on the age for infants and children. So here is a handy chart, or a pair of charts that can tell you whether someone qualifies or is eligible for TennCare, which again is Tennessee's Medicaid program. So you have annual and monthly income limits in dollars, and it varies by family size. And then the categories are indicated on the right-hand side for people, and corresponds to the percentage of the federal poverty level that the person has to be under in that category. So for example, for infants who are newborns up to 1 year old, the income limit goes up to 195% of the federal poverty level. And then depending on the family household size, that's where you can see where the income limit sits for that family. So if you have an infant that's in a family of 3 people, go to the column that says 195%. So the monthly limit for that household in terms of income would be $3,530 or $42,354 a year. So that's how you determine if that infant qualifies. You look at their age, the number of people in their household and what the percentage of federal poverty level is that applies to that category. And so some other categories just to point out, I mentioned infants and children and the fact that the income cutoff varies depending on their age. You also see here a program in purple, which is Cover Kids. That is also for children and also pregnant women who may be above the income limit for Medicaid, but there's another program called CHIP, or Children's Health Insurance Program, that stands on the shoulders of Medicaid and provides coverage to children and pregnant women who need access to health care. We won't talk a lot about Cover Kids or really any more about Cover Kids during this presentation, but it's just something to keep in mind if you or someone you know or work with may be over the limit for TennCare. Cover Kids might be an option to keep in mind. There's another category called medically needy. This is for children or people who are up to 21 years old. If they have significant healthcare needs, there's an option to spend down from their income in order to qualify for Medicaid. So that's for people who have really chronic conditions or serious complications or disabilities that result in really expensive medical bills. So that's something else to keep in mind if you know someone who has significant healthcare needs and may be slightly over income. TennCare Standard is a category for children up to age 19. Again, this is a unique program in that it only applies up to age 19, but it's for children who at some point qualified for TennCare, but then they lost eligibility, usually because of an increase in income. They can still stay on TennCare under the TennCare Standard program if they're under 211% of the federal poverty level, but if they have a medical condition that qualifies them, they can be above 211%. So again, those are options for people who have significant healthcare needs. Other categories include families, so that's for caretaker relatives. The transitional and extended TennCare are options for parents or caretaker relatives who were qualified for TennCare and their enrollment or their eligibility changed at some point. They can keep TennCare for up to a certain period. Other categories that specifically apply to women include pregnant women, women with breast or cervical cancer, and pregnant women who are medically needy. So those are also categories to keep in mind. You also see age, blind, or disabled, former foster care, and Medicare cost sharing. So for the former foster care category, this is especially important to highlight because there's not a lot of publicity that's done about this, but this is something that came about under the Affordable Care Act that was passed in 2010 during the Obama administration. So a lot of people may have heard about the fact that young adults could stay on their parents' plans until they turn 26, and that was a really popular provision for people. And so this is a category for people who were in the foster care system. Young people who are in foster care automatically qualify for TennCare and they have that coverage until they turn 21. This provision extends that until they turn 26. So it's a companion to the ACA provision for young adults who can stay on their parents' plan. This allows those foster care youth to stay on TennCare until they turn 26. And then the Medicare cost sharing, those are options for those older adults, 65 or older, who qualify for Medicare, but they're low income and they need help paying their Medicare premiums. Medicaid can cover those premiums for low income older adults. In terms of what medically needy means, there are certain conditions that the state has identified for examples of medically needy conditions. And so you would check the state's list to see if your condition is listed there, but it's typically really severe illnesses like cerebral palsy or other intellectual or developmental disabilities and significant chronic conditions that require extensive healthcare services. So it's not for your temporary conditions that some people may come down with and then recover from. Is more for those chronic, long-term medical needs that people would have that would create really high medical bills over the life course. Okay, so a little bit more about TennCare, our state's Medicaid program. TennCare covers right now about 1.4 million Tennesseans. That includes over 820,000 children, which is roughly half of all children in the state. It covers about 200,000 people with disabilities in our state. It also covers 60% of nursing home residents. So it's a significant source of funding for our nursing homes in the state. Approximately 20% of the state's population and about 50% of all states' births are covered by TennCare. I mentioned earlier EPSDT. That stands for Early Periodic Screening, Diagnostic, and Treatment. This is a benefit for children that is required by the federal government. And what it means is that children who are enrolled in Medicaid are entitled to receive whatever healthcare a doctor prescribes for them and says is medically necessary. So the state cannot apply exclusions or limitations on healthcare services for children. And then home and community-based services is sometimes shorthand called HCBS. This is for older adults and people with disabilities. TennCare covers long-term supports and services for these people when they need help with activities of daily living, such as taking medication or bathing or feeding themselves, etc. TennCare covers those services for those people. So who is not eligible but needs Medicaid? This is what we kind of want to talk about for the rest of the presentation and really kind of drill down on what Tennessee is missing out on by not expanding Medicaid under the Affordable Care Act. So right now, childless adults under the age of 65 who don't have disabilities are not eligible at any income level for TennCare because Tennessee has not expanded Medicaid. In other states that have Medicaid expansion under the Affordable Care Act, these people do qualify for that state's Medicaid program. But Tennessee is one of 12 states that have refused Medicaid expansion. That means over 300,000 Tennesseans, and that number is certainly rising because we know people have been impacted by the COVID-19 pandemic in terms of job loss or reductions in their income. It doesn't matter how little they earn. If they don't fit within one of those primary categories that I mentioned earlier, in Tennessee, they don't qualify. They can have zero income and still not be able to get Medicaid in Tennessee because we haven't expanded. So a little bit more about who falls into this coverage gap. We know that based on studies that were done a few years ago when Medicaid expansion became an option under the Affordable Care Act, the University of Tennessee School of Economics did a survey or a study that showed how many US veterans fall in the coverage gap, hourly workers, and your everyday community members, your neighbors who have jobs, but they don't earn enough to qualify for marketplace subsidies, and they don't fit within one of the categories to qualify for TennCare. So that leaves them in the coverage gap. The coverage gap was created because of a decision by the US Supreme Court several years ago that said states did not have to expand Medicaid under the Affordable Care Act, which is what the ACA anticipated when it was implemented, because it provided marketplace subsidies for people who were at 138% of the federal poverty level or above to go on the marketplace and find affordable coverage. And so the Affordable Care Act presumed that every state would expand Medicaid to cover people up to 138% of the federal poverty level. That didn't happen. So that created the coverage gap where people don't have an option to either enroll in the traditional Medicaid program that their state offers and they can't afford or don't qualify for cost assistance on the marketplace. A little bit more about Medicaid expansion in Tennessee. It would bring $1.4 billion each year into the state in federal tax dollars. And I want to emphasize that by not expanding Medicaid in Tennessee, we're not paying less taxes. Our tax rate is still the same in terms of the amount of federal taxes that Tennesseans are paying. It really just means that our tax dollars are sitting in the bank account of the federal government and not being sent back to Tennessee to support health care for everyone who could qualify if we had expanded. These additional funds would also help hospitals who are at risk of closing. It would create 15,000 jobs in the healthcare industry. Again, it would provide health insurance to over 300,000 Tennesseans, and it would also improve access to care and health outcomes, particularly for people of color. Because over half of the states in the country have expanded Medicaid, it kind of set up this natural experiment between states that did expand and didn't expand, so you can compare what does access to care look like for people, how have health outcomes been impacted by expansion. And study after study has shown that in states that have expanded Medicaid, there are fewer uninsured people. People are better able to manage chronic conditions or get the services they need if they develop an illness or have an accident. Nobody is immune from those unexpected healthcare crises that can come up. And it has also been important in providing financial security to people. We know that medical bills is something that is to blame for a lot of personal bankruptcies. And actually, Tennessee leads the country in the rate of personal bankruptcies caused by medical debt. And so in states that have expanded Medicaid, people have coverage for those unexpected healthcare costs, and they don't have to face financial ruin because of a healthcare issue that develops. So we have been organizing people at TJC and partnering with other organizations, including the Equity Alliance, who co-sponsored today's webinar, to really organize people and educate them about the benefits of Medicaid expansion and what Tennessee loses out on by not expanding our program to cover more people. So we're running these efforts to direct calls to our governor to ask him to expand Medicaid in Tennessee. There's a pathway to Medicaid expansion that we'll want to kind of drill down on. One thing that has to happen is we have to protect the Affordable Care Act. As I mentioned, Medicaid expansion is only available because of the provision of the Affordable Care Act that incentivizes states to expand. And so currently, a state that expands Medicaid can get 90% of the cost for covering that expansion population covered by federal tax dollars. So the state would only have to kick in 10% of the cost to cover those additional people in their state. Initially, when the Affordable Care Act was first implemented, that rate was 100%. So for states who got in early, they got 100% of the cost covered by federal tax dollars. So right now there is a state of, litigation that is pending and will be heard before the Supreme Court to do away with the Affordable Care Act. It's been in the news a lot recently, especially with the proceedings to confirm a new Supreme Court justice to replace Ruth Bader Ginsburg. Amy Coney Barrett was recently confirmed, and she will be on the court when they hear the Affordable Care Act challenge before the court, and those arguments start on November 10th, so 1 week after the election. And so what the court will be deciding in that case is whether the Affordable Care Act is unconstitutional and whether it can stand without the individual mandate. And so one of the provisions that got a lot of attention was this requirement under the ACA for individuals to have health insurance or pay a tax penalty. The Congress a couple of years ago did away with the tax penalty of the individual mandate. And so there's no consequence for individuals to not have health insurance right now. That really caused ripple effects in the marketplace, because the fewer people who are buying health insurance plans, the more costly it is for others who really need to go on and buy them and don't have a choice. And so the individual mandate was really important to incentivize healthy people to go into the marketplace and buy plans. But because that tax penalty was taken away, healthy people don't have the incentive to go on and buy those plans. It really caused a ripple effect in the marketplace and caused premiums and costs to go up. And so a lower court in Texas, in the case of California v. Texas, has already held that the individual mandate is unconstitutional. And so that decision was appealed to the Supreme Court, and that's what the court will be deciding. If the court strikes down the Affordable Care Act, that means a lot of the popular provisions that people have grown to rely on would go away. That includes Medicaid expansion. It includes coverage for young adults up to the age of 26. That includes protections for people with pre-existing conditions. So if you have a pre-existing condition, before the ACA, it was hard sometimes to find affordable coverage, and insurance companies could just choose not to cover you at all because of that condition, or they could exclude that condition from your coverage. The Affordable Care Act put protections in place so that that wouldn't happen. That would go away if the ACA was struck down. And there are several other provisions that are really popular that impact children as well as older adults that would be lost if the ACA were struck down. So depending on the outcome of the Supreme Court decision, we may be talking differently about options for our pathway to expansion. But one thing to note in terms of what may happen with the election is, if there's a new administration under current candidate Biden, then Congress could be more likely to change the way that the law is written to protect the ACA from further legal challenges. So they could make amendments in order to correct whatever the court says is wrong with the law that led them to think that it was unconstitutional. So the first step is to protect the ACA in order to make sure that our state still has the option to expand Medicaid. The next step would be to raise awareness. It's important for people to share their stories, either their stories about having healthcare coverage and what that has meant to them, and also for people who are in the coverage gap. It's important for them to talk about what it's like to not have access to healthcare, especially during a public health crisis, when you have an airborne virus that impacts people very significantly, and some people are more susceptible than others, and you never know when you'll get it or how your body will react to it. So not having the peace of mind of having healthcare coverage during the COVID-19 pandemic is really something that a lot of people maybe can't relate to. So we encourage people who are in those situations to talk about their experiences so that our policymakers can connect these policy issues to real life situations and people that they have sworn to protect in their capacity as elected officials. And so we have tools and information to help people who are interested in contacting their legislators and also contacting the governor. And why it's important to contact legislators is because they have the power solely to make Medicaid expansion a reality in Tennessee. Several years ago, the legislature in Tennessee passed a law known as Durham's Law, that's named after former Representative Jeremy Durham, who's no longer in state legislature. And that law basically took away the power from the governor to expand on his own. And so you cannot have Medicaid expansion in Tennessee without legislative approval unless that law is repealed or unless the legislature does away with that and decides on their own to expand. Right now, our legislature has refused to even consider the issue of Medicaid expansion. The party in control right now is the Republican Party, and they have gone on record as being against Medicaid expansion. The governor doesn't have the power to expand on his own, but he's still an important person to influence, because if he gets on board with Medicaid expansion, then he can lead his party members in the legislature to get on board as well. Some of you may recall that Governor Bill Haslam had a plan called Insure Tennessee that would do a phased approach to Medicaid expansion, kind of starting with certain populations to give them access to health coverage. And Insure Tennessee went nowhere in the legislature when it was brought up by Governor Haslam, and Governor Lee has gone on record as being opposed to Medicaid expansion in any form, even as recently as this year during the public health crisis. He has not changed his position about it. And so it's really important for people to speak up about how they feel about Medicaid expansion. We have seen polls conducted in Tennessee. In fact, last year, there was a poll by Mason-Dixon that showed that the majority of Tennesseans, including Republicans, do support expanding Medicaid in Tennessee, but somehow that message isn't reaching our elected officials, or they're ignoring it. And so it's really important that we make our voices heard. And that's why we think Medicaid and Medicaid expansion is something that every voter should know about and care about, because although our legislators have the power, voters matter too, and they can make their needs and their voices heard during this process. Other states that have expanded Medicaid, specifically Republican states, have been able to do it oftentimes by a ballot referendum. And that's where you can get a certain number of signatures on a petition to put a question on the ballot for voters to decide. Unfortunately, Tennessee does not have the option to do that because our Constitution does not permit ballot initiatives in that way. And so it really requires our legislature to make the step to expand Medicaid. That power has been taken from the hands of the voters because of the way that our Constitution is written and because of Durham's law that I mentioned earlier. Why Republicans are resistant to Medicaid expansion? Initially, they have cited the Affordable Care Act and the questionable legality of the Affordable Care Act as a reason to not expand. They said, oh, the ACA is unconstitutional, it's being challenged in court, it's going to go away, and so we don't need to expand Medicaid because the ACA is not going to be around. But the ACA was enacted 10 years ago, and it's still alive. And there are states and millions of people across the country who've benefited from the ACA during this time. And so to me, it was always interesting to say, we don't want to give people health care and then have to take it away in a few years, possibly down the road. If I were one of those people, I would say, yeah, I'd like to have health care for whatever amount of time I can have it. If I lose it later on down the road, then so be it, but let me have it for now. But that's not the position that our state leaders have taken when it comes to providing health insurance to those people. The Affordable Care Act, of course, has also been politicized because of people who were not fans of President Obama. This was his crowning achievement during his administration. And in fact, people, called it Obamacare as a way to really weaponize it and to stir up animosity and opposition to the law. And so the fact that President Obama was behind the Affordable Care Act, and Medicaid expansion is one of the key features of the ACA that could also be at play here. It's really putting politics above people and not really focusing on, okay, what is the policy? Is it good for people or not, regardless of which party proposed it or got it into action. And so we are really trying to encourage people to focus on the policy decisions and not the party, and really be loyal to the people that elected officials have been hired to serve, rather than being loyal to party lines. And so that's why we really want to elevate this issue, especially now during this election season, so that voters know elections have consequences, and you hold the power to influence policy decisions that your elected officials make. So you should know where they stand on these issues, and you should be speaking out to them about where you stand. So a few threats that I want to talk about for our Medicaid program, specifically in Tennessee. One is the failure to expand, which we talked about. Another is the block grant proposal. So I mentioned earlier that the federal state partnership with traditional Medicaid programs is uncapped. And so the federal government pays that percentage of the cost of the program, no matter how high those costs go. The reason that the cost would increase is for things like higher enrollment. For example, during an economic downturn like what we're in right now, or because of a public health crisis. Again, the exact situation we're in right now. But before the pandemic, Tennessee submitted a proposal to the federal government to block grant our program. And what that means is, instead of having that open-ended financing structure, the state would be asking the federal government for a set lump sum pot of money to run our program. And what the state proposed is that if Tennessee could spend less than what the federal government estimated our program would cost, then we would be able to share in 50% of those savings. It's important to realize that the only way to generate savings in our Medicaid program is to cut the number of people that you're covering. That would make costs go down and you would save money. You could cut how much services are provided under the program, so excluding certain things or placing a limit on the number of inpatient hospital days or therapy sessions or what have you, so cutting services. Or the third way would be to cut how much the state pays hospitals and doctors and other providers. Those are the only three ways to save money in our Medicaid program. For people who have Medicaid or have had any experience with it, you know that none of those three ways would be impact neutral on people who rely on Medicaid. If you're cutting people, that means fewer people can get access to the healthcare that they need. You're covering less children, less people with disabilities, fewer older adults, all of these people who would lose out if eligibility was rolled back on the program. You would also be hurting patient care if you're cutting services that people need, that a doctor has prescribed for them, and creating barriers for them to get access to the healthcare that they are entitled to. And then for providers who participate in the Medicaid program, first of all, providers don't have to participate. They can opt in to be an accepting provider under the Medicaid program. Those that do participate will tell you that the reimbursement rates are already very low. The low reimbursement rates is one of the main reasons that some providers choose not to participate and don't accept Medicaid, because they just can't, make it make sense financially. So to cut those reimbursement rates even further would possibly send more providers away from the program. And the fewer providers who participate, the less accessible healthcare is for the Medicaid enrollees. Because if you have an insurance card to go to a doctor and you can't find a doctor to accept that insurance, then you're missing out on care and possibly facing longer waiting times to get in to see a doctor, etc. So none of these three cost-saving options would be good for Tennesseans. Despite these issues, and despite a lot of opposition that people, including various healthcare experts like the American Heart Association, the American Diabetes Association, American Lung Association, the American Academy of Pediatrics, several healthcare experts and organizations that represent patients have spoken out against the block grant proposal. Nobody has really talked about how this would benefit Tennesseans, or if it could even generate savings in a way that wouldn't be harmful. Despite all of that opposition, the state still moved forward with the proposal, and it is still pending for a decision from the federal government right now. Whether that gets approved before the end of the year or before possibly a change in administration is unknown, but that is a threat that's out there to our program. Another threat that was also submitted by Tennessee was the work reporting requirements. What this would do is to require certain people who are enrolled in our Medicaid program to report on their work activities and show that they're meeting a minimum number of hours per week as a condition of keeping their health insurance. Other states have tried this and not been successful. In certain states, like in Arkansas, there were huge coverage losses. People were not able, even if they were working, they weren't able to meet the reporting requirements because of logistical barriers, like you could only report it if you had online access. This is a problem for people who don't have broadband, who don't have computers at home, or who don't have internet service, and they weren't able to get those hours reported online. Or for people who have an exemption from the reporting requirement, but they weren't able to gather paperwork to show that they were exempt and get that submitted in time. So coverage losses were documented in the states that have implemented work reporting requirements. And so those requirements have been challenged in court in other states. And the court, actually in the DC circuit, has heard those cases and has ruled that the work reporting requirement is not legal because it does not further the purpose of the Medicaid program. And so why Tennessee is proceeding with an idea that has been shown to be invalidated and harmful to people on the program, especially at a time when unemployment rates are rising and it's harder for people to work, is really troubling and concerning. But that is another threat that we really need people to be aware of during this time. And so again, that proposal was submitted by the state last year, and it has not been decided yet by the federal government either. So we're just waiting to see what happens. Potentially, if the current administration doesn't act on those proposals and we get a new administration in January, then it's unlikely that any Biden administration would approve such proposals. And so those would essentially be dead in the water. But between now and then, we just don't know what's going to happen. So we still have to consider them threats. Another threat that you guys should be aware of is wrongful disenrollment. Tennessee, for several years, was working on bringing a computer system online to administer applications for our TennCare program. When the Affordable Care Act was initially implemented, it required certain processes and systemic reforms to make enrollment easier for people. And the state's computer system was ancient and it wasn't able to meet those requirements. And so they had to create a new computer system. That was delayed by several years, but before the new system was brought online, which didn't happen until March of last year, the state started a manual process to renew coverage for people who were already on the program. the state had gotten a waiver for a number of years to not do the redetermination process, is what that would be called. And so they paused that for several years, but then in 2017, 2018, they resumed that process again, and it caused hundreds of thousands of people to be cut off TennCare because they either did not receive the hard copy paperwork that was sent out to them, or they received it and they sent it back in, but the state didn't process the paperwork. And so the Tennessee Justice Center has partnered with several other law firms to challenge this wrongful disenrollment that happened and resulted in so many people losing their coverage, even though they still qualified for the program. That litigation is pending in federal court in Tennessee right now, and we're just waiting on the court to decide if the case can go forward. What we're seeking there is for the state to fix their processes to make sure that people who qualify don't get cut off the program wrongfully, and also to reinstate the coverage of the people who were improperly kicked off. It's important to note that during this public health emergency that we're in right now, states are not allowed to disenroll anyone as a condition for having that enhanced federal match that I mentioned earlier. So the federal government has said, we'll give you extra money to cover the cost of your program, but you have to put a freeze on cutting people off. So that means during this time, as of March 17th, if you were enrolled in TennCare, you can't be cut off unless you leave the state, you voluntarily withdraw from the program, or you pass away. And so even if your income changes or your circumstances change, you can't lose your healthcare coverage right now during this public health emergency. The next item that is a threat is public charge. So public charge is an immigration principle that is applied to determine whether an immigrant would likely be primarily reliant on the government for meeting their basic needs. It's something that has existed for many years, but under the current administration, the rules have been modified, or they've been proposed to change to include other types of programs that weren't traditionally considered when deciding if somebody was going to be primarily reliant on the government to meet their basic needs. So that includes things like Medicaid, or the SNAP program, and other things that are not cash assistance. Historically, the only programs that were considered were programs that provided cash assistance, or things like support to pay for nursing home costs, those types of programs, but not your traditional health insurance or nutrition assistance. The status of public charge is up in the air right now. That has been litigated in court as well, to challenge whether it's lawful to make those changes to the way that rule is implemented. But it doesn't change the fact that it's caused a lot of fear and confusion among immigrant communities, and it has led some families to disengage from programs, even if they have citizen children who qualify for them. And even if those programs are not part of the public charge test, there's just confusion about which programs count, which programs don't, which people the new rules would apply to and which they wouldn't apply to. And so because of all of that confusion, people are just throwing their hands up and saying, I'm not going to engage in this at all. And so we've actually seen in the last few years, the number of uninsured children, particularly Hispanic and Latino children, has really gone up significantly. Our state now has a rate of about 5% of the children are uninsured in our state, which is up from a low point of around 3% when the ACA was first implemented. And so we're going backwards in terms of covering children, and a lot of that has to do with this public charge and this fear, the environment of fear that's been created impacting immigrant families. So that's another threat that people need to be mindful of. And we have partnered with organizations that serve immigrant families, such as the Tennessee Immigrant and Refugee Rights Coalition, to try to combat some of that information and educate people about what actually would count for public charge and who, would be impacted by the rule if it were to go into effect, and really try to encourage families to take advantage of the programs that they qualify for, because we know that having access to healthcare and nutrition support really makes a difference long term for people's health and for the community's health. One person's situation really does impact everyone when you're living in a community and you're talking about things like healthcare, and the ability for people to go to school, to go to work, and to be productive citizens in their community. And so we really want to reach those immigrant families and help them to overcome the fear and the misinformation surrounding these programs. And then the lawsuit to strike down the ACA, I've already talked about. That is a serious threat. Again, arguments are being heard starting November 10th before the Supreme Court, and it's expected that a ruling would come out next summer on that lawsuit. But again, the fate of the ACA not only depends on what the Supreme Court does, but it also depends on who's in office in terms of the White House, and whether the control of the Senate changes. So if you have a change in the Senate and the House of Representatives and the White House, and that those things align, then we may have an opportunity to strengthen the Affordable Care Act and protect it against further legal challenges. So questions. If you have a question, go ahead and type it into the Q&A box. All participants are muted, so you won't be able to verbalize your question, but go ahead and just type it if you have one. We have about 9 minutes left, so I'll give you guys some more time to think about any questions that you have. But if you are interested in healthcare or nutrition issues impacting Tennesseans, I would encourage you to follow the Tennessee Justice Center. We have a Facebook account, we have a Twitter account. We also are on Instagram. I didn't list that one on this slide, but if you're on Instagram, that's another platform where you can check us out, as well as LinkedIn. Also, our website is listed here. There's lots of good information on our website about all these topics that I've talked about and others that people should really know about. And the tools to contact your legislature and to contact the governor are also on our website. And so I will make sure to include that information in the follow-up email. Okay, so I see we have one question, which is what other organizations are working on this? Thanks for that question. So we are a part of a coalition. I'm assuming that this that you're referring to is Medicaid expansion. So we have a coalition that we are part of, that we help lead, called Ensure Tennessee Works, and it includes a couple hundred organizations actually who care about this issue. It includes the Tennessee Healthcare Campaign. It includes other organizations that provide direct service to low-income people, like the Matthew Walker Comprehensive Healthcare Center, which is a federally qualified health center in Nashville. It includes organizations in Memphis, such as Sister Reach, which is focused on reproductive health. There's a wide variety of organizations that have come together to try to work on Medicaid expansion in our state. And I'm sure I'm forgetting lots of them, but that gives you an idea of the types of organizations. They're primarily healthcare focused organizations and civic engagement organizations like the League of Women Voters and that sort of thing. And so we're all working together to try to make our voices heard to our elected officials to make this happen. I see another question is, can you speak again about applying for redetermination? Are they requiring that for nursing home residents currently? No, redetermination should not be happening currently. If you have heard of people who have been told that their coverage is ending, that should not be happening until the public health emergency ends. All redeterminations, including for nursing home residents, should be paused right now. As of March 17th, nobody should be getting redetermined. redetermination is not something that you have to apply for outside of this situation where everything is paused because of the public health emergency. Otherwise, the state would send you information in the mail telling you that it's time for you to renew your coverage or to redetermine that you're eligible. And so that's a notice that you should be getting from the state in the mail. But again, that process, even if the state decides to conduct that process during this time, they can't actually cut anyone off until after the public health emergency ends. And we would argue that once the public health emergency ends, the state should be resuming that redetermination process and not basing their decisions on whatever they determined before the public health emergency ended, because your situation could be different, months down the road. So again, nobody should be going through redetermination in terms of having their coverage terminated. We have heard of people receiving notices from the state that says, even though we can't terminate your coverage right now, we've determined that you no longer qualify, and as soon as the public health emergency ends, you're going to be terminated. We would challenge those. It doesn't have an impact right now because we're still in the public health emergency, but you should still challenge those because your situation might be different at that time. Who knows when the public health emergency will end and whether your eligibility will be the same now as it will be then. Another question is, what can a person do if they apply, denied, but have a disability and is losing insurance? Is there an appeal process or something that can be done? Absolutely, there's an appeal process, and we are coming up on time, so I will have to cut my response short on that, but there is an appeal process that is run by the TennCare agency, and they have information on their website for how to process an appeal. And I can share that link with you guys in the follow-up email. If you have applied and been denied and you want to appeal, the Tennessee Justice Center does help with that, specifically for our TennCare program. If you have a disability and it's more of a Social Security issue or SSI, that's not something we help with, but we do have colleagues at Legal Aid that we could refer you to. And I'm sorry, my doorbell is ringing if you can hear that. Okay, so the next question is, how long are they keeping on TennCare because of the COVID? We don't know how long the public health emergency will last. Again, it was just recently extended through the end of the year. And so that means at least through the end of the year, they can't terminate anyone from TennCare as long as they want to keep that enhanced federal matching rate. So whenever the world reopens and we can declare the crisis averted, it's anybody's guess, but that's how long TennCare would have to keep people covered, however long this situation lasts. So if you have any other questions that we didn't get to during this presentation, feel free to email me. Again, my email address is listed there, and I will send you an email with a copy of the slides as well as a recording of this webinar. And I really appreciate everyone for joining us. Thank you. Have a great day.